My name is Nakibuuka Maxensia. I am a HIV, AIDS, and human rights activist and a founder of Lungujja Community Health Caring Organization based in Lubanga Division of Kampala District in Uganda. I am 46 years old and I'm a mother of 4 and a widow for the past 16 years. I was tested and found to be positive in 1998. And after that testing, it wasn't easy for me to accept the results. Then it was followed by the death of my husband in 1999. It was so traumatic caring for him when he was so ill and in denial. The consequences after his death were quite many, including organizational stigmatization, that I lost my job. I was down, sickly, and had lost hope even to bring up my children. Thanks to Lungujja Christian Caring Community, an NGO in Kampala that offered me a lot of treatment, care, and support, as well as counseling myself and my family, up to today that I can even be this strong. My family and myself have been supported by caregivers, pastoral counseling from religious leaders, and treatment. In 2005, my CD4 went as low as 88 because I had no job, I had no food for my children, I had no income, I was sick. So I was bedridden several times and immunity went low. It was PEPFAR Fund and Global Fund through Lungujja Christian Caring Community that I started ARVs in 2006. Since then, my life has been progressing so well. What did I do? I chose to be part of the activism to end HIV. And I offered my own premises to have a clinic that is offering treatment, mobilize women and men and youths to do caregiving from house to house, follow up on adherence to patients who are on treatment, advise on nutrition and other support services. And for the past 6 years, myself and 56 caregivers have every day volunteered to do this. So which means ARVs is a very big support to our health. If we had ARVs by the time I lost my husband, he wouldn't have died. I thank God that I had access to treatment and now I'm becoming so strong. When you are infected by HIV and AIDS, it's not only drugs that you need to live. You need support, you need care, you need counseling, you need food, you need every kind of support. And unfortunately, we are not getting this support. Many lives have been lost. An example in Uganda, as I talk now, there is a big stockouts on TB treatment. And people are bound to lose lives because there is not any available TB drugs in many outlets in Uganda. I had a case before I came for this conference of a colleague who is registered with the National Referral Center to have TB treatment. He was referred to a mission hospital to access TB treatment and the National Referral Center could not support him to have this. Myself, I'm proud to be this strong. This is the same thing I would love to see happening to the many people, the whole world, who need to have access to treatment, access to ARVs, access to TB drugs, so that we can have healthy people who can plan for their families, who can do work themselves, who are not bedridden. So reduce burdens on governments to plan for illnesses, but to plan for people's development. I have seen many changes in my community, positive and negative. Our country spearheaded the advocacy on HIV and AIDS in the early 80s, 90s. But now the virus is rising because there is reduced education, sensitization, and support to people, especially those at risk. In Parliament, we have two controversial bills, the HIV bill and the anti-gay bill. As we mobilize everybody to come and voluntarily test, now we have these legislators who are sitting down and then making these bills, scaring people away, including myself. Because if an HIV bill is saying whoever will be found positive will be put into jail, I'll be the first person because I'm positive. Is this how governments should support us? Nobody has ever knelt down to pray to God to get HIV. What about the younger children who get transmitted HIV from their mothers? What about the young girls who are raped? What about the people, the sex workers who are just desperate on the streets? Should we hold them as criminals? Or we need to think again about how people catch HIV and AIDS? Therefore, I call upon my government first to support its own people. Give us the support we need. Bring the drugs. Put it at every point that is very accessible for everybody to reach. Educate the people that the virus is still with us. And we are so grateful to the Global Fund that has supported us all this time around. And we still cry to you, Global Fund, to give us much more support so that you can save more lives, and then we can kick AIDS out of the whole world together.